Alzheimer's disease is the most common form of dementia in the elderly and affects 4 million people in the United States. Now, dementia is a medical term for a decline in mental functioning, and patients with Alzheimer's have a progressive decrease in their mental state that affects many areas, including memory.
I think probably my husband noticed the problem maybe before I did without telling me about it, but I noticed that he began to not be able to find places when he was driving that he used to be able to find.
The primary symptom is short-term memory loss. This is something that we're all susceptible to, but short-term memory loss to the point where it's clinically significant, that the person is starting to lose track of their keys, their financial activity, they're leaving the stove on, etc. That starts to become a much more worrisome clinical picture.
Other symptoms include disorientation, poor judgment, and changes in mood or behavior. Now, it can be difficult to diagnose someone with Alzheimer's disease, as Dr. James Patterson explains.
It's difficult to diagnose Alzheimer's, and the reason for that is that until you look at the brain tissue under a microscope, it's really a diagnosis of probable Alzheimer's disease.
Dr. Patterson is doing research at the LSU Health Sciences Center in Shreveport to detect Alzheimer's in its earliest stages. He uses one of the latest imaging devices available to medical science, the PET scanner. Patients suspected of having Alzheimer's have an image made of their brain by the PET scanner. This device measures the metabolism of different parts of the brain. Areas affected by Alzheimer's show up as a different color, red in this case, as compared with normal brain tissue, which appears yellow. While there's no cure for Alzheimer's, earlier detection may mean that doctors can treat the disease sooner, slowing its progression, and may give them a chance to prevent it entirely. From the LSU Health Sciences Center in Shreveport, I'm Dr. Keith Payne.